I'm going to show how to do a insulin injection. So I would grab my medicine, I would double check the physician's orders, make sure that I have the right dose and the right medicine. I would grab my medicine and I would do my 6 medication rights and then my 3-way check. So I'm going to knock on my patient's door, introduce myself. Hi, I'm Sarah. I'm going to be your nurse today. We're going to give you your insulin injection. Is this a good time? I would verify my patient's name, date of birth, and double check it against their wristband. And then ask my patient if they have any questions, just ask. I'm going to do my hand hygiene. Got a paper cut. Okay, and then I'm going to apply my gloves. And the first thing I'm going to do is prepare my syringe. So I've got my insulin syringe here. Grab this. I would discard that in the trash. And before I open that cap, I am going to prepare my vials. So I've got here my regular insulin, and then I've got my NPH insulin. So with the NPH, the cloudy, I'm gonna roll it in between my palms. I wanna mix the solution. I don't wanna shake it because that can create air bubbles. So then after this is good, I'm going to open alcohol swab. And then I'm just going to clean the tops of each vial for about 5 seconds. Okay, and I would discard this. All right, and now I'm ready to prepare my syringe. So with the cap, I'm going to face that up on a clean, clear surface. And then I'm going to, with the NPH, draw up 16 milliliters of air. So there's 16 milliliters. And I'm going to put that into my NPH, my cloudy. Put the air in, push it in, draw up. And then for my regular insulin, my clear, I'm going to draw in 12 milliliters. 12 units, not milliliters. Okay, so here I've got 12 units of air. I'm going to push that into my regular clear. Push the air in. Now I'm going to flip, and with the clear or regular, I'm going to draw in 12 units of regular insulin. Okay, and now for my NPH or cloudy, I'm going to insert it into the vial. And here I'm going to draw out 16 units. for a total of 28 units. Okay. Now with this, I'm going to put the cap back on. Another way I could have done this was the swoop method. And I'm going to prepare my client's injection site. So I'm going to cleanse the area and then I would let it dry. Discarded that in the waste basket. Grab my syringe. This cap can now be thrown away. And after my patient's injection site is dry, I'm going to pinch an inch and at a 45-degree angle, insert the syringe, inject the insulin, and then I would take it out at a 45-degree angle. And now with my syringe, I want to put the safety mechanism on by pushing it against a solid surface. And now this is ready to go into a sharps container. I would then take my gloves off, do my post steps, perform hand hygiene. I would make sure that my patient doesn't need anything, give them their call light, make sure the bed is in the lowest position and locked. Ask them if they need anything, and then I would go document.